There we go. We want to welcome all of you. Thank you so much for taking a few minutes or taking your lunchtime today to join us for this webinar, Healthcare First and for All. And this is a very special presentation that Steve and I put together along with a lot of other partners that we have that we've been working on inside of a commitment to making rural healthcare work for everyone. And so just to tell you a little bit about ourselves. Uh, let's see here. So I'm Jerry Bridge, and I've been working in the healthcare industry and around that industry for 30 plus years, actually more like 35 years, and mostly working with healthcare providers and staff on ways in which we could empower them to do their work more effectively and to be well at the end of the day and to flourish in the process. So I'm very passionate about supporting you and your colleagues. One of the programs that I've led for many, many years is called If Healthcare is About Well-Being, Then Why Am I So Stressed Out? And it was always, I was always interested in how do I empower the people that care for others. And so that you can more effectively do your jobs and take care of people. So that's what I'm doing here. And as I say, I live on the central coast of California, and I'll leave you with Steve to introduce himself now. Go ahead, Steve.
Good morning, everybody. I am, as Jerry said, in the jungle of Costa Rica. That's not a Zoom backdrop, if you can
Mm,
see me. Uh, and I have been in healthcare almost 40 years, and my passion is taking care of people, and it always has been. If I asked you why you got into healthcare, I'm sure not many of you would say because I wanted to get rich quick.
mm,
Uh, Most of us who are in healthcare are in healthcare because we're about caring for people's health, caring for others. And so I have spent a long career building coalitions that do that, that included everything from a water ambulance service in the jungles of Nicaragua to provide emergency medical transportation to those villages that didn't have access, to building tools in the Veterans Affairs Administration to allow people that are serving the veterans to do a better job. And in the building of those, I found that what a concept. When people are happy and people are flourishing, businesses seem to be more productive and more successful.
yeah.
So I'm all about that. And given what's happening in our country right now with rural health care and the trials and tribulations, we decided to put together a coalition, a group to figure out how we can have rural health care be supported and survive and be
Mm,
empowered and actually flourish. And that's what we've done. Okay. And we created something, and we're going to talk about this, and it's very early stages of formulation. So we're thrilled to have you here with us
yeah.
because we're kind of exploring, we're figuring it out. And our mission is to empower rural healthcare facilities, their staff, and their patients to flourish. So we're in the process of forming a 501(c)(3) to begin researching and vetting how can we put together services and opportunities that really allow you to do what your jobs are, which is to provide care to people, is to have people be well. And Jerry, if you could just pop that flyer up.
Yep.
It really started just out of the work we do in talking about people's well-being and health. And we had a lot of people at conferences and vendors come to us and start talking about, um, gosh, we love your message, and we want to help rural healthcare. We want to help facilities too. These are our customers, these are our friends, and we want to see them do well. And out of that, we put together a coalition of some really seasoned healthcare professionals. People like Jerry and I have been in this a long time. And our mission is to empower rural healthcare facilities and staff and patients to flourish. That's the whole focus. We feel if your facility is flourishing, your staff is flourishing, and your patients are going to flourish. And that's ultimately what it's all about.
Hmm.
So, as I said earlier, we're a 501(c)(3). We research, identify, recommend clinical, financial, technical, and administrative services that support rural healthcare facilities. And we work with rural healthcare facilities and offer our research and what we found to you at no charge. There's no charge to the facilities. Because for us, healthcare is no longer about or not about money. It's about caring for people's health. So that's what we do. And ultimately, our goal is to help you offset revenue losses, enhance quality, improve patient care, and a lot more to that end. And
Yeah.
we do this by working with facilities and finding out their needs. And as I said, we're busy researching solutions, and that's what we're going to talk about today. Jerry, could you go to the purpose for today's session?
Well, actually I can, but the next thing we want to do is just learn a little bit about you. If you could either throw it up in the, yeah, throw it up in the chat, or if you want to come on camera, we'd love to meet you. Because it's not television. We really are talking to you right where you are. What's your role and why did you choose choose a career in healthcare? As Steve said, you didn't do it to get rich. You're here for a reason, and we'd love to hear about that. So, if you could go ahead and just take a minute and put in the chat, what's your role? If you want to put up the name of the facility where you work, give you a shout out there. But, who are you? Why do you do what you do? Love to hear that. So go ahead and do that now. I'll just look at the chat here. And this is an interactive conversation. We can't disrupt healthcare in the way we want to and make it work without you. So, what's your role? Why did you choose a career in healthcare? Okay. I'm not seeing anything in the chat. Kelsey, are you there?
Yep, I think they're just starting
Oh, here
out
we
right now
go.
to come over.
You
Here
got to
we
give them
go.
time to type, Jerry.
All right. So Melissa from Seven Corners Healthcare specialize in coordinating inmate healthcare in the community.
Mhm.
Great, Melissa. And anything, if you want to share anything about, what had you be in that role or,
Yeah, really interested in why you got into healthcare.
all right, there's Rose. I am the healthcare educator at Sullivan County Health Department. I love working in public health and assisting in my community. Right on.
Yeah, that's the juice.
Thank you, Rose.
Rose.
Appreciate that. Okay, let's see. Oh, we got some more here. So we've got Melissa says, I think I chose this background in administration and government policy. Okay, I think it chose me. Okay, gotcha.
Yeah, exactly.
Very good. My name is Dwayne. Thanks, Dwayne. Dwayne is a patient care manager, an educator to help people with diabetes and get people the healthiest that they can be. That's just awesome, Dwayne. Thank you for sharing that. Jay, TRS Managed Services and International. We help rural health hospitals with workforce strategy solutions. Excellent. You're somebody that we definitely want to talk to going forward. We are, as Steve said, we are a coalition that's building like a snowball going down the hill on a snowy day. The more that we share our message about healthcare working, healthcare first and for all, we're meeting so many amazing partners and building this coalition, and it's making more things possible. So, Steve, is that pretty good?
Yeah, that's great. Nice to
Awesome.
meet you all, and thank you for being here. We appreciate your time and your interest.
Absolutely. And we'll have more opportunities. You can anytime that you have a question or a comment, just throw it up in the chat and we should have some time before we end for questions and comments as well. Okay, so Steve, I'll just go ahead and read this part
Yep,
and then we
go
can get
ahead.
into it. So healthcare first and for all, this is innovative strategies and solutions for rural and critical access hospitals. Rural hospitals and critical access hospitals face increasing pressure from financial constraints, workforce shortages, and evolving healthcare technologies. And so, what's the purpose of this webinar? The purpose of this webinar is to explore with you how to empower your facility, staff, and patients to flourish.
And
And
let me just say something about that, Jerry,
please.
because we really mean that. We're in the formulation stages, and we're meeting a lot of interesting people, and we're coming up with solutions we never even thought of that could really benefit rural facilities. So when we invite you to explore that with us, if we're talking about something, we're going to go over the things that we've been finding just to share them with you. If you have thoughts about those, or you think, wow, maybe what we really need is a solution for maternity care or something that we haven't stumbled upon or met with yet, we'd love to hear that from you. It will just help us to flesh out what we're doing and create packages and services that can really support rural facilities.
Yeah, it's really great what you're saying, Steve, because as we develop this whole Healthcare First initiative and this webinar, certainly, we've kind of been listening kind of for two things, like, what's wanted and needed. I mean, how do we really, like, no kidding, bring solutions and strategies that actually make healthcare, rural healthcare sustainable well into the future, especially in the face of so many challenges, as mentioned in this opening. But we can't do it alone and we can't do it without you. So we've always said we feel like we're flying the plane as we're building it at the same time. So you're listening for maybe some strategies and solutions, and you've given your valuable time to be on this webinar today, but you've also got something to contribute, and we are all ears. We take no pride of ownership. We can't make an impact without you. It's all hands on deck. All right.
So
Uh,
that sounds like a pretty good way to spend your lunch, I hope.
and we do really have a specific, when we developed our the mission of the Healthcare First Initiative, when we use the word flourish, we mean that in a very specific way, and that is to grow or develop in a healthy or vigorous way, especially as a result of a supportive environment. Healthy and vigorous. Healthcare really is about well-being, and that includes all of us, you in your chair, your patients, your staff, and we really do mean that, all of us. And so again, this is what we're doing now, is sharing strategies and solutions that can strengthen your sustainability in sustainability, improve workforce stability, and enhance patient outcomes. So here are our intended results today. Number one is to share funding opportunities and resources for cutting costs and improving reimbursement. Now, I know nobody's interested in finding new sources of money, right? At your facility. Steve, anything else you want to say about that first objective?
No, that's pretty clear.
Okay. And the second objective is to discuss how using AI, artificial intelligence, technology, risk reduction, and community health, which should say community health worker programs, how that can lower claim denials, enhance patient safety, increase patient satisfaction, and employee retention. So that's a lot, and we're going to break it down for you. But those are the areas in our over a year of doing research out in the field and with seasoned experts. Those are kind of the areas that have been emerging as we've been developing this conversation. So everybody on board with that? Thumbs up somewhere, somehow, those two objectives. All right, Steve, should we move on?
Yep, let's move on. And what
All
we're
right.
going to do is we're just going to talk to you about the areas that we've been exploring and some of the some of the solutions and companies that we found. We're not going to be talking about any companies in specific, but we're going to be talking about uh, the ideas and the concepts that we've uncovered. And hopefully that might trigger something in you, and you might be able to come up with an idea or some thoughts about other areas or other ways and things that we can look at this point.
Yeah. Okay. Um, so the first one is funding resources. We talked about that first objective is newfound money, opportunities to generate or locate revenue. Steve, you want to talk about one of these first opportunities that we?
Yeah, sure. I'm sure you're all familiar, or maybe some of you are not. USAC, there's money available, reimbursement for telecommunications technology, and a lot of facilities are leaving a lot of money on the table, is what we're finding. They're not implementing all the strategies, and they're being overburdened with reporting requirements. Some of them are waiting a year or more to get their funds when it's available to get them immediately, but they don't know how to take advantage of that. So we found through certain resources that there's ways to do that. And I think, well, you all know Tony Butts. He's a member here and he's on the call.
Yeah.
Tony's an expert in that area, and he's advising us in that realm.
Yeah.
But it's a way to bring additional revenue and income into your facility. Some of the things that we found is a lot of facilities are members of larger organizations, and rather than applying as the organization, which provides additional funding opportunities, um, they're applying individually and they're missing some of that. So we're looking at ways to optimize that as a funding resource.
Yeah, this is really exciting. And just to give you a little bit of context about this and how this thing is really taking off, Steve mentioned Tony Butts, he's on the call, and some of you may know him or be familiar with him.
Yeah, he's been a member
I
for
I
years now.
bumped into Tony about a year ago when I was in Indiana speaking, and he and I spoke, and part of what he explained to me was for every dollar of reimbursement that your facility spends on internet technology communications, that's reimbursable up to 65%. And many of you may already be doing that, but we're in one case, we're working with a group in Idaho that was getting reimbursed, but they had $500,000 of reimbursements that they were not getting because their particular resource for getting that money was not most effective. Let me just say that. They weren't as effective and efficient as they could be. So in speaking with Tony and then putting those entities together, we're able to help them tremendously get that revenue flowing. And don't you think that having that money in their bank makes a big difference? So we're very excited about that as one opportunity. And Steve, anything else you want to add to that?
We'll cover some more in the other areas, but
Yeah.
you know, claims denial management is another critical one for improving uh, revenues. Use of
Yeah.
AI. I've been in this industry a long time and have watched the insurance companies deny claims with some of the most creative reasons in the world for years, and have been helping facilities to collect on those claims denials that are unfair. Well, recently we know that insurance companies are using AI to generate new types of claims denials, and we've identified resources so far that are using AI to fight those AI claims denials quite effectively,
Yeah.
and at the same time reduce the administrative burden of chasing that money that you're entitled to. So that's an area that we're exploring, and we're seeing tremendous possibilities and opportunities there, and continue to be vetting that. So speaking of AI in particular, a lot of the facilities we talk to, we find are afraid of AI. What does it mean? What is AI? Am I going to lose jobs, or are people going to get laid off? And in a rural community, you don't want to do that. Well,
Right.
that's not necessarily the case, but one of the things we've explored is and are working on is how do you educate people effectively on AI and how to use it in a way that benefits and connects your community instead of isolates and separates it. That's a key factor for us. So
Yeah,
AI for reimbursement improvement is a big area that we're exploring and working on.
tremendous asset. And just in the chat, I'm curious about, I'd love to get some feedback on this. If you could just put up if you're currently engaged with AI strategies, or you've been having conversations with your staff, or if there, as Steve said, what we've come across is, when you don't understand something, or maybe it feels like a threat a little bit, is this gonna, what is this gonna mean? Is this gonna cost jobs? So we kind of know it's coming, but we haven't really gotten the kind of the education that we need to understand it. So any comments about AI, just throw that up in the chat, because you're helping us to help you, and
Right.
and everyone, please. These didn't. I'm just going to put all these up here, and we can. There you go. Okay.
Now
So
let's talk about AI again for eliminating administrative burden on the care staff.
yeah,
I mean, for years I taught documentation requirements, and documentation takes that healthcare staff away from caring for patients. And there are some real tremendous inroads being made with AI in utilizing it to do that documentation effectively, efficiently, and allowing the healthcare staff to eliminate much of the administrative burden. In some cases, we're seeing it up to 60%.
yeah,
So we're looking at how to utilize AI to eliminate that administrative burden on the care staff and put them back where they belong, which is caring for the patients. So
yeah.
it's a big area. And again, I'd be real interested to hear just generally in general terms, where are you at with AI and how important an issue is learning AI or figuring out how to use it? How important would you put that for your facility or your organization?
Yeah, please let us know what's happening. Here we go. Thanks, Tony. Well used AI. Tony says, well used AI enhances and supports departments, removing burden, making staff stronger and well prepared. Absolutely. That is what we're hearing from one of our partners, is leveraging this technology to make your life easier so you can focus on what you're there to do. Absolutely.
Okay.
Um, y- yeah, I was going to comment on something and I forgot what it was. Steve, you have something?
No, I'm older than you, Jerry. I forget things.
Yeah. Um, and by the way, Steve and I both have, as he mentioned, we started together way back when. We have a lot of experience with insurance and insurance company denials, and the frustration and the heartache, and the hand wringing and the stress about getting paid. And so if we can leverage technology to get those bills paid and to allow you to focus on what you're there to do, that's a win-win-win. Another area where we're we're excited about is the cost of insurance, insuring your facility. We're speaking with at least one partner who actually goes in, isn't looking to just sell you insurance, but is actually looking to mitigate your risk for everything from falls to patient abuse to cybersecurity, and train you and your staff on mitigating that risk such that it lowers your premiums. So that's
It
another,
not only lowers your
yeah,
premiums, but it reduces incidents,
yes,
you know, adverse incidents that occur in facilities. And so the idea again is to see what we can do to have the facility and the staff flourish. And by reducing that risk, it eliminates a lot of those problems and consequently then reduces insurance premiums. And to be clear, we're not here to sell you any of the services or any of the partners that we're talking to. We're here to share with you the information that we're finding, maybe trigger a little thinking in your areas about where you might be able to utilize some of these things.
Yeah. Another area that's not specifically listed was another organization that we've spoken with that was very enlightening. I've got two in mind. I don't know how many of you in your area are having trouble locating specialty providers. So you may be in an area where somebody comes to get care from the primary care provider. They need to go see a specialist. Maybe the specialist is a great distance away. Maybe there's transportation issue. Maybe there's a concern about continuity of care and this patient's condition and getting that record to an out of area provider or hospital. Um, we thankfully have been able to understand and learn from at least one technology platform that's actually connecting primary care and primary care patients with specialty providers that that maintains continuity of care, that maintains where that patient is comfortable and still working with your primary care provider, and they're getting the best care possible. Maybe they're getting that by telemedicine, or maybe they're having to travel, but it's a solution where there may not be that provider in your particular area. So that's one of them. Steve, anything you want to add to that?
They really specialize and provide the technology to keep the primary care provider in communication with the specialist that they refer. They provide that technology.
Yeah.
And another group that we found, tremendous group, and people are starting to work with them more and more. They provide radiology reading services remotely, also providing the technology that gives you radiology reads on your stat patients and all patients within an hour. And they do it in an incredibly reasonable result that provides a service that many of the rural facilities we work with don't have the capability to pay for.
Yes.
So again, it's about keeping the care in your community. It's about keeping the care in your facility. And for us, these are really exciting opportunities that we're discovering, because I'm telling you, 2 months ago, Jerry and I had no idea these things were available,
we
you know,
we didn't even know how to
just through
talk
our
about what we're
research.
talking about. Yeah.
Yeah,
Yeah.
right, exactly.
Yeah.
Don't think we're
And
expert.
and we learned, as Steve's talking about radiology and imaging. We were talking to one group of rural hospitals, some of which, because they didn't have the staff to do all the reads and interpretations, these images were just stacking up. I mean, hundreds and hundreds and hundreds. And, without those interpretations ready to hand, people need to know that so they can deal more effectively. The docs can take care of them. So this entity was able to offload those electronically to an outsourced radiology service who read them all within a very short time and found maybe 7 or 8 critical reads that were then potentially life-saving, and got that back to the facility and then got the medical attention that they needed. So we can't not share these with you when we know these solutions are out there. And if you're already doing that, great. But if you're interacting, maybe after this webinar, you're debriefing, you'll get a copy of it. There'll be a recording of it. This isn't the end all and the be all. This is a generative, exploratory conversation where we're just kind of, unearthing what's possible and bringing that to market. So, yeah. Then, of course, staff well-being. I mean, I don't know how many of you, we talk to a lot of people that, you love what you do, you're committed to it. but some of us are toast by lunch. Just how do I keep up? I'm tired. I'm not taking care of myself. How many of you are not sleeping through the night? Not eating well? You know, we've we've um, we've met with at least a couple of organizations that are organized to work with you specifically and your workforce to make sure you're eating well, exercising well, have nutrition programs, in service phlebotomy, where you get your blood work, different resources for staff. And as Steve said in the beginning, hey, when I get what I need and I'm taken care of, I'm good to go. I'm happy. I'm energized. I'm supported. Why would I leave this facility? Why would I go anywhere else? Steve, you want to add anything to that?
No, just that it's, it really underlines what the mission of the Healthcare First initiative is, that if the staff is not well, if the staff is not cared for, they can't do a good job of taking care of patients. And we're seeing this uh, echo throughout the business world these days. I don't know, some of you may or may not be aware that a very unpopular decision by Walmart was to provide medical insurance to all their employees for $39 a month. Shareholders didn't like that, but they did it anyway. And mysteriously, Walmart revenues are up and profits are up. And, you know, they can make a direct correlation between taking better care of their staff and productivity and, and their customers get more well cared for. So this is really the heart and soul of the Healthcare First initiative is taking care of people. That's what healthcare is all about. And when people are taken care of, they don't leave. My greatest accomplishment I consider in my career was that in all the companies I had, I never had an employee quit. And I was successful in all those companies, but I never had an employee leave. Well, I had one, and she came to me crying because they'd offered her so much money to leave. She didn't want to go, but and it was because we considered the well-being of our staff to be number one. And the result was we did very well economically. So we didn't make our decisions solely based on money. We made them based on what was best for our staff and what was best for our customers. And the rest of it worked out. And it made it a very happy place to work and happy place to be. So to me, that's the crowning glory of my career, in running businesses is that I didn't have any employees leave.
Yeah, I can attest to that. That I went to work for Steve in 1991, and I can't get rid of the guy. We just keep we keep going through, but it's really because who he is, is the heart of the matter is caring for people, and that's it. And that last bullet up there, the human connection. That's what we're here to do. In a world where driven by technology, how do we bring human connection? That's the one thing that matters in the end. I had the unfortunate experience of my personal story of losing my brother, my sister, and my mother to cancer in a 10-year period. And it was hard, man. I mean, there were years where I was either taking one of them to the primary care provider, the specialist, or this and that. And I am so thankful for the care that we received was extraordinary in the face of very, very difficult times. So what always mattered to me was people that were connected, supportive, and loving. Even when the staff was overwhelmed, they were there, you were there. And that's what matters in the end. And that's what we remember. And so the healthcare first and for all, and the healthcare first initiative is really designed to allow us, you, our facility, to live this each and every day. Not like a panacea, because it's not perfect. There's going to be breakdowns, but if, as Steve said, if we can get our priorities straight from top down, man, we're unstoppable. So I'd like to, if you would put in
Let
the
me just say
chat,
something, Jerry,
yeah,
before you move on, because this is a really
yeah,
great point to make.
yeah,
Um, one of the things that we've found, we worked with a facility and great facility, all their stats are good except for patient satisfaction.
mhm,
And the patient experience. And why was that, we found? We found it was due to the fact that they're too busy to listen to their patients. The essence of the discovery was that the patients didn't feel heard because the staff is just too busy doing their jobs to take care of their patients.
Mm.
And one of the resources, and some of you may use this, some of you may not, but it's a tremendous benefit, is a resource called community health workers.
Mm.
Okay. And these are folks that just want to take care of people and they want to help. And what they do best is they listen, and they can help patients navigate the mysteries of our system, of our healthcare system. And it's very inexpensive, but it makes that human connection. It has there be somebody there that people can listen to, that will listen to people, and they can talk to, and they can express their concerns and their fears.
Mm.
So it's an area in which we find makes a tremendous impact at a low cost, is to find community health workers, certified community health workers, and build a program to have them listen to and work with your patients, because that
Wow.
human connection is everything. And I want
Oh,
to ask you, Jerry, I'm going to tell you right here where healthcare breaks down. Jerry,
yeah.
do you want to share what happened with Joy?
Yeah. So, my wife, we're very healthy. Our baseline is, we go out, walk for an hour. We walk faster than most people can run. So we've been doing that for 25 years straight. That's part of our daily habit, and we love that. Now, 6 months ago, we're out for a walk, and we barely went 2 blocks, and she's starting to have palpitations. She's dizzy, blood pressure's up, like, oh my God, we got to go home. So put a referral into the primary care provider. She refers us to the cardiologist. Cardiologist says you need a nuclear stress test. Okay, we got to get the referral. That was back in February. It's now what month? May?
May.
It's 5 or 6 months later. We've got to wait till June 15th. We're in a rural area. And we're not blaming anybody, but she's completely, she's debilitated. She cannot get to see the doctor for which we could find whatever the problem is, so we could get her health care resolved. So right there is just, we're a living with this example that Steve's talking about, is we can't get to who we need and what we need in order to get her taken care of.
So there's nobody listening. She couldn't even get, for weeks, she couldn't even get a referral to a cardiologist. And that's where healthcare breaks down.
Yeah.
When there's nobody to listen, when there's nobody to care, that's where it breaks down. And so what we're committed to is finding ways to reverse that, is finding ways to have healthcare first.
Yes. And I wonder how many of you, and none of this is personal, like when you're busy, when you're working and you got to get it done, it's urgent, you got to get it done. And what Steve's saying is one option, community healthcare workers. That was another group that we met when Steve and I were in Virginia. They're doing an amazing job around the country, training up people in the community, lay people who want to be able to go and visit Mrs. Jones, who's maybe her husband died, and she needs to be reminded to take her medications. Or she just needs somebody to hold her hand and listen to her. How was your day? They can do that off-site in the person's home. They can also come to your care setting and help absorb, and they love it. That's what they're there to do, is to be there, to be loving, to listen. And that's just tremendous. Or
Yeah,
you
and
or
they
your staff.
personify healthcare.
Say that again, Steve.
I say they personify health care. They're caring.
They they really do. They
Well,
are the care. It's the
yeah.
listening. And then we are also, we ourselves, Steve and I, have a lifelong passion for, how do we be better listeners? And how do we train up leaders and other people to listen in ways that pull for well-being, especially when you got the alien on your face. The alien on your face when you're just like, you got so much in front of you, right? So all this is possible, but what I would love to, because we're doing great on time, you guys, is I'd love for you to put in the chat, or if you want to come on camera, some brave soul, please, when you look at the list on the agenda, funding, use of AI, cost reduction, insurance, efficiencies, staff training. Please indicate one area that you've either been concerned about, you heard tell back at work that you really, boy, if we could do better there. Doesn't have to be anything elaborate, but if you could just identify either one area or maybe one idea you have. Steve?
Yeah, something you've identified in your facility that, boy, if we could figure out a way to do this, that would be a tremendous advantage, a tremendous benefit to us. But we'd love to just open it up for questions and comments and, what your thoughts are and hear from you if this is resonating with you.
Yeah, we'll just give you a minute to do that.
Be
And
on the spot.
I'm staring at the chat box, so I'm looking. I'm monitoring. I'm monitoring as we speak. Oh, we're having way too much fun. I hope your lunch is good too, you guys. Who's going to be the first to comment? Please. Like Miss
Anything
Nancy, I
come
see.
in yet?
Well, go ahead.
I said I'm not seeing anything come in yet.
Yeah, I'm looking too.
Okay.
I see Melissa. I see Rose, like Miss Nancy from Romper Room. I see Gabriel. And you might even look at, well, what prompted you to be in this webinar? Was there something that you saw in Healthcare First and For All that went, oh, yeah, like a possibility? What would that look like? Anybody?
They must be having dessert now.
All right. Well, can somebody just give me a thumbs up in the chat to know that, so we know you're still here? Being talked to death is a terrible death, and we want to make sure we're connecting. Put a thumbs up or a one. Put the number one if you're getting any value in the chat, so we know you're here. Oh, good. There's a one. Thank you. Thank you, Melissa. Thank you, Amanda. Tony, thank you. Anybody else? All right, we got at least 3 people. Come on, engagement. Part of the secret sauce is engagement. Great, Rose. Great. Thank you. Thank you. All right. Okay. All right, Steve. Let's share this next slide, which is the this is also by way of who we are, the Healthcare First Initiative. We're just so proud of what got created, Steve, in what, less than a year. Tony can attest. And who we are. That QR code, if you scan that, it will take you to a web page. That's that web address there, that bit.ly. And for anybody that wants to learn more, and again, this is not a pitch. We need you. We're learning from you. We're co-creating this, but if you have anything to share with us, you want to learn more about who we are and what we're up to. So we want to give you this time to ask any questions or share any insights. There's a typo underneath Q&A. It says healthcare FIRTS, FIRTS. Should be first.
For questions come in, I'm going to go ahead and launch our post survey.
Sure.
So you can, two quick questions to answer. So you can go ahead and answer those as you're typing in your questions, and we're waiting for them to come in.
Sure.
Just something I can mention, the way we work when there's a facility that has any interest, we do a free listening session. We would just sit down with somebody from your staff, your administrators, your CEO, CFO. We sit down with all different kinds of people and just listen to where you want to go, what your vision is. We don't really focus on what's wrong. We focus on where you want to get to, and
Right.
see if we can offer solutions or opportunities, or at least begin to research services and things that might be able to fulfill that service or that vision for you. So we're happy to do that, and there's no charge for it.
Yeah, yeah, absolutely. And I can tell you, and to some degree, it's blowing our mind because again, we had this thing is really organic. It came out of the need. The government was talking about cutting funding for rural care, and we're like, whoa, that's going to have an impact. And then we just happened to be doing work, as I say, in Indiana, all the I states, Indiana, Iowa, Idaho, and one of our contacts in Idaho um, was talking about uh, just I lost my train of thought, sorry, but at any rate, we just started running some of these resources against what they're doing, and it turned out to be very fruitful for them. We just listened. We said, Bobby, what do you need? How can we help your providers? And so they're beginning to bring solutions in that they didn't have before the listening sessions. The other thing that you might want to put into the chat too, I know IRHA may be also doing this, is they're doing lots of webinars, is any other topics that, given who we are, we might be able to address with you. All right.
I'm not seeing any more questions come in. I think you guys covered
All
everything
right.
great.
Right.
Okay. Thank you, Kelsey and Danielle. Thank you for your support. And
Yeah.
thanks for
So
sharing your lunch with us, everybody.
yeah, and the last thing is one of the um, if you haven't read Care of the Soul in Medicine, Thomas More, I recommend that for anybody who has a heart for healthcare and for just being able to live that moment to moment again in a world that's pulling us to go faster and faster and driven by technology. We have more uncertainty, a lot of craziness happening. And how do we ground ourselves? How do we be more connected with ourselves, with our staff, with the people that are coming to us? When you truly serve, instead of doing a job, you connect with them. And I know in your heart of hearts you're doing that. You're wanting to do that. And so let's connect. There's my information. We really appreciate your time and your listening. Steve and I don't take that for granted. And if we've been able to make a positive impact, we're happy. And if you have questions, we're here. We're not going anywhere. Anything else for you, Steve?
No, thank you very much for your time. And I'll be in Indiana next week, in 2 weeks.
There you
I grew
go.
up in Fort Wayne, so
Wow.
I
What are you
got
going to do
I got
there,
a little
bud?
connection there. Yeah.
Where can they find you?
Well, my grandma's house isn't there anymore, which is where I used to spend all my time. But I'll be in Fort Wayne
All
with
right.
my cousins and my aunt.
Awesome. 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 All right. Thank you, everybody.
Thanks.
Thank
Okay.
you.
Bye.